Alright, let's dive into something that's been making waves in the health world lately, and trust me, it's a big deal. Imagine a drug originally designed for weight loss, but it turns out it could be a game changer for heart health, especially for people with diabetes. Sounds almost too good to be true, right? Well, that's exactly what a new study is suggesting about Mounjaro. Here's the thing, this isn't just about shedding pounds, it's about potentially saving lives. And personally, I think this is one of those moments where science surprises us in the best way possible. So, let's break it down. This study, published in the BMJ, looked at nearly 53,000 people with type 2 diabetes and heart disease. What they found is that those taking Mounjaro were 33% less likely to have a heart attack compared to those on another diabetes medication called sitagliptin. Let that sink in for a second. A third less likely to have a heart attack, that's huge. But what makes this really interesting is the broader implication. We're talking about a drug that's not just managing blood sugar, it's potentially reshaping how we approach cardiovascular care for millions of people. Now, here's where it gets even more fascinating. After just 1 year, the risk of major cardiovascular events dropped from 4.4% in the sitagliptin group to 2.9% in the Mounjaro group. That's one less major event for every 70 people. In my opinion, this isn't just a statistic, it's a lifeline. For someone with diabetes and heart disease, that kind of reduction could mean the difference between a hospital stay and living a fuller, healthier life. But it's not just about heart attacks. The study also found that Mounjaro users had fewer hospital admissions for infections and lower overall mortality rates. That's a triple threat right there. Of course, no drug is perfect, and this is where things get a bit nuanced. Last month, another study linked GLP-1 agonists like Mounjaro to hair loss, with hundreds of reports coming in from the UK. Now, I'll be honest, hair loss is no small concern, especially when it comes to quality of life. But if you take a step back and think about it, the trade-off here might be worth it for some people. A detail I find fascinating is how these side effects are being reported so openly. It shows that while we are celebrating the benefits, we are also not ignoring the downsides. That's how progress happens, through transparency and balance. What this really suggests is that Mounjaro isn't just a weight loss drug, it's a potential powerhouse for managing chronic conditions. But here's the bigger question, why is this happening? What's the mechanism behind it? Personally, I think it's because these drugs are doing more than just lowering blood sugar. They're likely reducing inflammation, improving insulin sensitivity, and maybe even directly protecting the heart. That's speculation, of course, but it's a theory that's gaining traction in the medical community. One thing that immediately stands out is how this study challenges our assumptions about diabetes care. For years, we've focused on managing blood sugar levels, but this research hints that we might need to think bigger. What if the next wave of diabetes treatment isn't just about glucose control but about holistic health? From my perspective, that's a paradigm shift we need to pay attention to. Now, let's talk about the elephant in the room, accessibility. Mounjaro isn't cheap, and not everyone can afford it. What many people don't realize is that breakthroughs like this often highlight disparities in healthcare. If this drug is as effective as it seems, how do we ensure it gets to the people who need it most? That's a question we can't ignore. So, where does this leave us? Well, for starters, it's a reminder that science is full of surprises. A drug designed for one purpose ends up having a completely different, and potentially life-saving, impact. But it also raises a deeper question. How many other treatments out there have hidden benefits we haven't discovered yet? Personally, I think this is just the tip of the iceberg. As we keep digging, we might find even more ways to improve health outcomes for chronic conditions. Before I wrap this up, I want to leave you with a thought. If you or someone you know is dealing with diabetes and heart disease, this study is a reason to feel hopeful. But it's also a reminder to stay informed and have conversations with your doctor. because while Mounjaro might be a breakthrough, it's not a one-size-fits-all solution. What this really suggests is that the future of medicine is about personalization, innovation, and thinking beyond the obvious. So, what do you think? Is Mounjaro the next big thing in diabetes and heart care, or is it too early to tell? Let me know your thoughts in the comments below. And if you found this video insightful, don't forget to like, share, and subscribe for more deep dives into the world of health and science. Thanks for watching.